Well, switching gears now, May is Skin Cancer Awareness Month and the beginning to the unofficial start of summer with longer sun exposure, and skin cancer is the most common type of cancer diagnosed in the United States. But not everyone knows what skin cancer looks like. I spoke to a dermatologist about what it looks like, and she shares some tips.
The sun. It promotes vitamin D production, bone health. It even supports your mental health. But there's no such thing as a healthy suntan. When it comes to skin cancer, early detection equals better outcomes. Dr. Katie Fiala is a dermatologist at Baylor Scott & White. She says the most common kind of skin cancer is basal cell carcinoma.
A lot of times people will tell us, gosh, I thought it was just a pimple or something, and it wouldn't heal and it wouldn't go away. It kept bleeding. It kind of grew a little bit.
She says melanoma is more aggressive. ABCDE is a helpful way to help remember any significant changes in the development of this type of skin cancer. A for asymmetry. Healthy moles should be round. Moles with an irregular shape are suspicious. B for border. If the mole has an uneven border, this may be cause for alarm.
Where the borders of the brown spot are jagged or irregular.
C for color. A mole should be deep brown. If it has any discoloration such as red, white, pink, or deep black, it should be looked at.
If you have multiple colors within the mole.
Diameter. Any mole that is larger than 3 millimeters in diameter should be checked.
But we definitely have caught melanomas smaller than that. So things that are new, growing, or changing, you don't have to wait until it's the size of a pencil eraser.
And E for evolution. Closely monitoring moles is important. A mole may seemingly look harmless, but once there are any signs of the other 4 changes, it's time to notify a physician.
If you have an old mole that's been there for years and years, and then all of a sudden it starts to bleed, change, grow, change colors.
Dr. Fiala says stay out of the sun during its harshest times of 10 a.m. and 4 p.m. Wear sunscreen, do not burn. Reapply sunscreen every 2 hours. Wear protective clothing like sunglasses and hats, and do self-skin checks every week. In Waco, PJ Hessner, Fox 44 News.